incision that was made. So I'm going to be working on 8 and 9, or 1, 1 and 2, 1. So as I was saying, there's an incision here. I'm going to try and go below it, because if I go here, then I'm in the unattached gingiva. So you want to incise in such a way that you're touching bone. Your scalpel should move all the way onto the bone. You're doing fine, Susan? Yeah? You don't feel any pain, right? Yeah, okay. Generally, I would scallop it a little bit, but in her case, because we have that straight incision on top, I'm not going to do much of scalloping. There's no room actually to do much of scalloping. So we're going to go on the other side as well, and we will make that incision line join up. Just let us know if you feel any pain whatsoever, okay? You're doing very, very good. Section right there, so you want to join that up nicely. So I'm incising all the way to the bone. You always put your scalpel all the way to the bone. So remember we spoke about the fibers. These are your fibers. See the blood vessels? So you're not going to incise like this, you're going to incise like this. And that gives you more room as well. So I'm going to go all the way down to bone and then incise through and through. She's comfortable. It is okay if you go over on both, but you make them join with a little bit of a curve. Similarly, we're going to do one release incision on the other side as well. So again, in the direction of the fibers, which go in this direction, all the way to the bone, and then you incise. And here I'm going to do that for you. Go over, that's fine. See how you go over, that's okay. So you have periosteal elevators here. It's up to you whether you want to start in the corner or you want to start. So there's going to be a lot of tugging and pulling, okay dear? Yeah? Just a lot of pulling and tugging. There shouldn't be any pain. So as I was saying, this is a surgerized area, so this is going to be a little bit rough to retract because the tissue is already quite tough. We're going to start at this end. So when you're retracting, you want to walk on the bone. You want to stay on the bone. The more you tug at the tissue without being on the bone, more bleeding will happen later on. See how the tissue is tearing? You just want to be on the bone. Just feeling a lot of pressure, okay? A lot of pressure. A little bit. Once I retract you, you'll be perfectly fine. Walk on the bone.
Okay.
So see this side, she didn't have any surgery. This is our non-surgerized side, so the tissue comes off much easier. Again, always on the bone. So when you see tissue tags like that, take it off with the periosteal elevator. Don't tear the flap. If it doesn't come off, take your scalpel. Just suction right there.
Okay, okay. Thank you.
Take the tissue and suction right there. Inside. There you go. and you want to just take the tissue out. Take your time. You want to take your time with reflection of the flap. There's no rush. So, this is the frenum. Now we're moving into one area. Because she has missing laterals, because the bone is further down. You want to make sure you keep your elevator on the bone. Finger rest. So you see this, there's still a tag which is unattached. Don't rip it. Scalpel. Cut it. So we have a nice clean incision. Cut the tissue. Don't rip at it. You doing good? Yeah? You okay? Yeah? See, remember we spoke about, you can already see that the sinus tract is not on the root but off to a side. You can already see these things. It's a lot of tension, okay? But I'm almost done. All this thing is all done now. I need to look at this.